Good afternoon, and thank you so much for joining us for this update from your coronavirus headquarters. I'm Jordan Fremstad. In Wisconsin, there are more than 450 cases of coronavirus and 5 deaths in the state. Monroe County has confirmed its first case of COVID-19. In a release from Fort McCoy, a Department of the Army civilian employed here tested positive for COVID-19 virus yesterday. The employee is currently in isolation at their residence and following medical guidance. Health officials say it's a man in his 50s who has no known exposure through travel or contact with a confirmed case. In La Crosse County, there are 5 new cases, bringing the total number to 10. More significantly, 2 of these new cases are a result of community spread, meaning they have not been exposed through travel or a known coronavirus case. We've also learned that an employee of Train Company in La Crosse has tested positive according to a company safety recording. An employee at Plant 7 is at home recovering from the virus. All employees who had close contact with the person have been notified. First shift this morning was shut down while a deep cleaning started. Minnesota is seeing its cases of COVID-19 go up as well. There are now 287 confirmed positive cases in the state. There is still just 1 death that was reported last weekend. The Minnesota Department of Health is now reporting 2 cases in Winona County. According to the Winona Post, 2 residents at the Sawyer Nursing Home in Winona have tested positive for COVID-19. 2 family members of residents posted online about the news, saying they had received calls from the nursing home explaining the situation. It took 67 days for the worldwide number of reported cases to reach 100,000 and just 11 days to reach 200,000 and 4 days to go to 300,000. David Begnaud reports from New York City, the nation's biggest hotspot.
We remain deeply concerned about New York City and the New York metro area.
That is because more than half of the nation's new coronavirus cases are being found right here. Crowded subway cars may have accelerated the spread. New York's governor says FEMA gave the state 400 ventilators. To that, he said this.
What am I going to do with 400 ventilators when I need 30,000? You pick the 26,000 people who are going to die because you only sent 400 ventilators.
The governor now projects that the state will need up to 140,000 beds with an additional 40,000 ICU beds.
I would be lying if I didn't say there's incredible amounts of stress.
Across the river from New York, at Holy Name Medical Center in New Jersey, the chief infectious disease specialist says his hospital has just 10 ventilators, barely enough for now.
But if the worst is yet to come, as we're expecting, then it won't be.
The mayor of Los Angeles says New York could be a preview of what's to come.
We are anywhere from about 6 to 12 days behind what we are seeing in New York City.
And now to Louisiana. Cases are growing faster there than nearly any other place in the world. They now have more than 1,300, which per capita puts them behind New York and Washington State. Louisiana's governor asked the president to declare the state a major disaster area, and President Trump has. Back in New York, COVID-19 has infected one of New York City's finest, 27-year-old NYPD officer Christine Galgano. Now, her case is unique because she also suffers from lupus, and because of that, she is already taking hydroxychloroquine. We spoke to her by phone.
That is a medication that they are trying out to see if it can also help people with COVID.
But they're having me double up my dose as well to see if it's helping. And so far, I've gotten through all of these symptoms fairly quickly.
There are 177 NYPD officers who have tested positive for COVID-19 so far. David Begnaud, CBS News, reporting from my home here in New York City.
And early this morning, Senate and White House negotiators reached a deal on a rescue package to inject nearly $2 trillion into the U.S. economy. The Senate is expected to approve a more than $2 trillion stimulus package today. The bill includes a direct cash payment of up to $1,200 for most working Americans, $3,000 for the average family. It also expands unemployment insurance from 29 to 39 weeks for most people and boosts benefits from $600 a week through July. There are 2 events being held tomorrow for people in our area to give blood with extra precautions in place due to the coronavirus. Toma Health is hosting a Versity blood drive tomorrow from noon to 5 p.m. and visitors will be pre-screened before donating. You can request a time to donate at tomahospital.org, and anyone who donates will get a free pint of custard from Culver's in Tomah. In addition, the La Crescent Community Blood Drive is still going on, but will be hosted at the La Crescent Area Event Center. That drive will run from noon until 6 p.m. We want to thank you so much for joining us for this coronavirus update, and you can always get the latest information anytime on our website, news8000.com, or download our mobile app. We hope you can join us tonight for News 8 Now at 5 and 6.